So I want to start first by polling the audience. I want you to raise your hand if you're a strong and independent. Me too. Now, I want you to raise your hand, but only if you feel comfortable, if you've suffered abuse. Me too. I'm Amber Lovatos. I'm a strong and independent woman. I'm a key opinion leader. I'm a dental director, a boss, a business owner, a hygienist, a mother, and a wife. I was also a victim of intimate partner violence, formerly known as domestic abuse. My ex-husband was both physically and psychologically abusive to me. I used to say that if he hit me, I would leave him. But he didn't hit me. He didn't slap me or punch me, no. He grabbed me and pulled me and dragged me and accidentally gave me a black eye. He also controlled me. And the control was really the hardest part. He belittled me. He put mental anguish on me. One of the ways that he controlled me was through economic deprivation, making sure that I didn't have money so he could control me. I wasn't allowed to have a job. Even if I wanted to get a job, he didn't let me renew my dental assisting certification. What kind of job was I going to get? How was I going to provide for my boys? He took my car away, so how am I going to get to work? He also controlled who I talked to and who I saw. If I wanted to see my parents, he would let me go see my parents. He would take me there. He would drop me off, and then he would lurk around. He would watch me, stalk me. In case I left, he would know. He wouldn't say anything about it. He would just put it back in his mind, and when he needed to, he'd pull it out. And him knowing all these things about me made me extremely paranoid. So I had to tell him absolutely everything because I wanted to avoid the trauma. I wanted to avoid getting in trouble again. He didn't let me talk to people or see people. I once had a friend call my parents because I wasn't allowed to have a cell phone. That would be too much. And I refused to talk to my friend because in my mind, he would find out. Who would tell him? My friend? No. My parents? No. But in my mind, I knew he would find out and I would be in trouble. And I was tired of being in trouble. Eventually, I did leave. And what helped me leave him were people acknowledging that what I was going through was abuse. So that eventually, I could see the abuse. My dad gave me two options. Either to leave him, or he was going to make me leave him. I don't know what that means because my dad is the nicest guy around. So why am I talking about this? One, because I think that there is a reason that I went through what I went through. It's so that I can educate dental professionals on abuse. Two, because we need to break the stereotype of what victims of abuse look like. It is not just victims who are in community health centers. It is not the underserved. It's you, it's me, it's the people in this room. I talk about it because we need to normalize the feelings that victims of abuse have, like shame and embarrassment and pride. My parents were right. He's not a good guy. I didn't listen. Here we go again. Amber doing something dumb. And now she's going back home to her parents with less than what she had. And I loved him. We talk about this because our job is more than just preventing caries and cario. We treat the entire patient. And our job doesn't end when we leave the clinic. We talk about this because in children, 50 to 65% of signs of abuse happen in the head, the neck, and the mouth. Where do we work? The head, the neck, and the mouth, right? It is our job to know the extraoral, interoral, and behavioral signs of abuse, to know that bilateral injuries to the body, that bruising in varying degrees, that trauma that doesn't align with the explanation are signs of abuse, that scarring and leathering of the commissures is a sign of being gagged. I want to take a moment and talk about adults who are children who suffered abuse, because I don't think we talk about them enough. For them, the trauma doesn't end when the abuse stopped. For them, it might take a lifetime to get over the abuse. It'll take years of rationalizing through the shame and embarrassment, although they have nothing to be ashamed and embarrassed about. And so they might not feel comfortable sharing these things with you. So how do we identify them? How do we help them? These type of victims will have a hard time being put in vulnerable situations, like being laid down. What do? We lay them down. They'll have a hard time with people putting things in their mouth, with their nose being covered, with their mouth being covered. They'll have a fear of being gagged, of not being able to swallow, and not being able to breathe. So the next time you have a patient who's difficult, and I hope that the majority of your patients are just difficult, but if you have a patient who's difficult, I can ask you to consider that maybe they have something else going on that you may not know about and you can't understand. And I ask that you provide them with grace and compassionate care. Thank you. Yeah!